Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about diabetes mellitus. When I left up last week, I was talking about some of the early symptoms of diabetes. And in this segment, I'm going to talk a little bit about some of the more later symptoms when the blood sugar is, in fact, has already become elevated. And before I do so, I need to refresh your memory a little bit about some of the stats involving diabetes. 425 million people across the world suffer from diabetes. 22 million people have type 1 diabetes. And diabetes is a very serious problem. 1.6 million people die of diabetes every year across the world. In this country, 79,535 deaths occur because of diabetes every year. 79,535 deaths every year. Okay, serious problem. Right now, it's very interesting that several weeks ago I began to talk about diabetes mellitus. This is show number 4. However, a few days ago, on Monday to be exact, a very important, well-written and well-detailed article came out in JAMA, and it's talking about the same issue involving diabetes and prediabetes, etc. Unfortunately, the article was not very complimentary of the physicians in terms of being able to diagnose what is the so-called prediabetes and how to deal with it, etc. Let me give you some of the stats that I copied from part of that article that came out in one of the network. It said nearly a quarter of young adults and one-fifth of adolescents in the United States have prediabetes, research indicated. The study revealed that the prevalence of prediabetes in male individual was almost twice that in female individual, 22.5 versus 13.4% in adolescent and 20.9% versus 18.8% in young adults. This is serious problem. I cannot stress enough the importance of knowing what the symptoms are so that one can proactively begin to do the right thing to diagnose individuals who are in fact predisposing to having diabetes, who are having the so-called prediabetes, which in fact in my view does not exist at all, and it is serious business. Let's talk a little bit about the other symptoms when the blood sugar has already become elevated. When the blood sugar has already become elevated, that's called hyperglycemia. When hyperglycemia occurs, these individuals most likely have been diabetic for many years before. They just didn't know it because the blood sugar hadn't become elevated yet. But there are other conditions that was taking place that was really very damaging to the body. Once hyperglycemia exists, aldolase reaction, that is aldolase reductase reaction, must take place. That's part of the process. Once that becomes overactivated, automatically two sugars come right into the picture, namely fructose. Fructose is, of course, very benign. It doesn't hurt anyone. You have to understand that once the glucose becomes elevated, several other sugars become elevated with it in the bloodstream. We just don't measure for them. But the sugar that is the most dangerous beside glucose itself is sorbitol. It is inevitable once hyperglycemia exists, there's going to be aldose reductase activity that automatically causes fructose and sorbitol to become elevated. The sorbitol is the most damaging of all the sugars. The bulk of the damage that is done to the nerves and a whole lot of other tissues in the body is because of the sorbitol. So one of the symptoms that one might see, somebody may develop a rash under the breast. Somebody may develop a rash in the groin. or recurrent fungal infection in the genital area might occur. Numbness, tingling, lassitude, depression, insomnia, constant feeling just lousy, not knowing what's going on. And the reason why that's taking place is because without the proper metabolism of glucose, one cannot use oxygen properly. And without oxygen, one cannot function properly. So now you see one of the reasons why you have this lassitude. Tremendous amounts of electrolyte problem. I said, well, how so? Well, if you cannot use glucose properly, then the pancreas doesn't have a brain, but it senses that you need insulin to try to help you to use the glucose. So it's dumping insulin into the bloodstream. But once you have a lot of insulin in your bloodstream, things are going to happen. Because insulin is an anabolic steroid. Anabolism means that you're building something. You're hungry. You feel the need to eat. In particular, food that contains simple carbohydrates such as glucose, because you have to satisfy the level of insulin that is in your circulation. Well, here's the deal. Once you got the insulin there, if you're going to use it, then of course what's happening in the insulin is going to cause you to have a whole host of other problems, namely electrolyte problem. The number one electrolyte that one loses when one dealing with diabetes, of course, is potassium. You can't have high level of insulin without affecting your serum potassium. But it gets more complicated than that. Because if you remember, potassium is a K+. So when you're losing potassium because you have high level of insulin, you must lose chloride as well, because the potassium, which is K+, need a minus to attach with it. That chloride is a minus. So you're going to lose potassium chloride. You said to me, but Val, what are you getting to? Well, if you're going to lose potassium chloride, whenever you lose something, you must retain something else. What are you retaining? You're retaining sodium. Sodium is an Na+. But the Na+ need a negative to be associated with it. That's bicarbonate. How about that? So if you have a high level of sodium bicarbonate, you are alkalotic. And alkalosis is an unnatural phenomenon. Creates a lot of problems. The body did not create the body to be able to handle alkalosis very well. The body was created to be able to handle acidosis much better. So when somebody is acidotic, the serum potassium goes up. Okay, when somebody has alkalosis, the serum potassium goes down, and you have a whole host of complications. I'm describing these things to you so as not to impress you of my ability to know this stuff, but just to let you understand you have electrolyte problems. So that's one of the reasons why you're having all these symptoms. A whole host of stuff is taking place. So whenever you see this fungal infection, no matter where they occur in the body, be it in the groin or in the genital area, you must quickly try to get in touch with your doctor so the doctor can not just treat it, he or she's going to treat that, but also going to evaluate you. That may be the first indicator that you are in fact diabetic. Because you understand something. Why the fungal infection is occurring? Well, If it's occurring under the breast, you sweat. The sweat is sweet sweat because your sugar is high. And wherever sweets exist, fungal grow. How about that? Wherever sweetness exists in the body, that's where fungi is going to grow much more easily. So you have to understand this concept. This is why one of the things that this very important article that came out this few days ago was not very complimentary of practicing physician in this country, because, as the article pointed out, they're just not understanding what is going on. All these little details that I'm telling you, many folks who are really practicing don't understand these things. They're supposed to, but they don't. Or if they did, they forget about them. And that's the problem. If I said that myself, you would have said, well, Val is being Val. The truth is, I'm not being Val. Look at what Jama just said a couple of days ago. I started this series several weeks ago, and sure enough, this article came out, not only substantiating everything I've been saying, and making it worse. I wouldn't dare read some of the stuff I see in that article to you, because it will not be appropriate, but you can go and read it if you want to. It was JAMA. It came out on Monday. This week. I believe Monday was the first, if I'm correct. You can get your hands on that if you want to bother to read it. Suffice it to say, you have to be proactive. You have to have enough knowledge, enough understanding of physiology, pathophysiology, chemistry, to be able to put this thing together, to understand that some of these things occur way before the blood sugar becomes severely elevated. Diabetes itself has a tremendous amount of problem. Elevated sugar is nothing to play with. And I'll be talking about this, and believe me, this is the 4th show that I'm talking about the basics, so that when people are having all these symptoms, rather than spending thousands and thousands of dollars doing a lot of very expensive tests, go back, pull back a little bit, think a little bit about the basic, and try to evaluate why these patients are feeling so unwell, and yet it is not obvious as to what is going on. It may not be diabetes. It could be something just as important as diabetes, but if you take a step back and begin to dig into it by doing certain things, you have to understand every single diagnosis, every single illness, or all illnesses that exist in the field of medicine has a key to diagnose it, just like every lock has a key. But if you know what is going on, I have a sheet here. I don't think I have it with me. Here it is. You can't make this up. I have this. I've been practicing privately for almost 42 years now. You can't make this up. This is something, I put this together myself. I bet you can't find that in another physician's office. I put this together myself. So sometime when I'm sitting, as I'm listening to the patient, as I'm taking the history, I'm asking questions. Before I even touch the patient, I begin to check off some of the stuff that's going to confirm what the patient is telling me or not telling me. And I put this together myself. There are almost 200 different tests on these sheets. I give it to my medical students every year before I finish teaching them. I tell them, hold on to this. It's going to serve you in the future. Because there is not a single disease of significance that cannot be diagnosed using this form if you know what the keys are. You have to know which test to order. The test can either confirm it, or one single test can eliminate 12, 15 conditions. Because there's no way those conditions can exist if this test is negative. There's no way. Now or 10 million years from now, there's no way that can happen. But if you know what to do, then you don't have to go through all this hassle. In any event, this is my form that I put together myself over the years, and I keep adding to it. I keep adding to it every now and again when I feel like it. Okay, so I just want you to understand. Look at this. I just started this show several weeks ago. This is show number 4, and yet a few days ago, this article came out. Not only backing up everything I've been saying, but also even more serious than even I had already described. So you have all this stuff without the sugar being grossly elevated. You got all these abnormalities. The time will come when I'll be talking to you about all the stuff that elevated sugar itself can cause. So now I'm getting to the point now we're going to begin to evaluate a patient. How about that? I know you've been waiting for that for a long time. Somebody comes in, you don't know anything about them, you're seeing them for the first time. You're taking a history from them. Take a complete, thorough history. What is the chief complaint? You deal with that first. Take the past medical history very completely, thoroughly. We're going to take a family history, very, very important. We're talking about diabetes now. You're going to find out what are the diseases the mother or the father of that individual either has or have had. What disease that her children, if she has children, have, etc. What kind of work the individual does. What kind of habit is smoker, an alcohol abuser, so on and so forth. And so you take this long history of surgical histories, etc. You do all the usual thorough stuff. Then, of course, it's very important when you begin to examine the patient. If the patient is obese, that's crucial, because obesity is a major predisposing disease for the development of diabetes. And the main reason that is so is because when an individual is obese, you can't be obese, don't be insulin resistant. You're insulin resistant because the pancreas senses the need for insulin downstream. The pancreas keeps pumping insulin into the bloodstream. Keeping in mind that all of us were born with a specific quantity of beta cells in our pancreas. The pancreas has multiple functions. One of the major functions is production of insulin because of the beta cells that reside in the pancreas. Once you lose them, you can't get them back. So all the time that you can't be obese, live long enough, don't subsequently become diabetic, because the obesity individual is insulin resistant. When the insulin gets into the bloodstream, it cannot penetrate the fat cells. And all that time the insulin is sitting there, number one, is causing a lot of damage. That's right. This very important hormone, insulin, is causing damage as well. Well, I just told you about the electrolyte deficiency issue. But are you ready for this? Insulin is atherogenic. Insulin itself can cause the development of plaques in somebody's vessels. How about that? This has been proven through research. So important though insulin is, it is very, very damaging sometimes to the human body, and yet you can't survive without it. It's a balance issue. So obesity is very crucial. So you see that, you're examining the patient, so right away You look at the skin. The skin is super important because there are many, many infections, rashes that can develop because someone is diabetic. You say, well, what is this all about? What is this predisposition to infection? Well, diabetes mellitus itself causes the white blood cell not to function properly. White blood cell cannot migrate properly through the site of infection because when one is diabetic, there's an abnormality in the migration of the white blood cell toward the site where an infection exists. That's one of the reasons why it's very difficult to heal a wound in someone who's diabetic. Not only that, there's a vascular issue because of the flow problem, I'll get to that, but also the white blood cells are not functioning properly. There's a migration abnormality. Now you know that. The hair is very important. You evaluate that. So now that you've done all the skin, now you got to evaluate the pulses. It's crucial. Is there any deficiency? Is there a pulse that you cannot feel? Is there some dependency when you look at down the leg? Is there some discoloration because of lack of flow, proper blood flow, etc.? So that's very important. And now you're going to examine the eyes very properly, examine the mouth very properly, the nose very properly. The neck is crucial to examine the neck because an individual is obese. You want to make sure they don't have any abnormality that can be palpated in the neck, i.e. in the thyroid, etc. Very crucial. Examination of the carotid artery is very important because if you have diabetes, you are predisposing, the individual is predisposing to have occlusion of the arteries. And of course, one of the arteries that you're very concerned about is the carotid. So you can listen to that. There's a way to listen to hear if they have a bruit or something like that. Then you examine the lungs very properly. Examine the heart properly. Then you examine the abdomen. Then you're going to do a thorough neurological examination. Remember, the patient is likely to be complaining of numbness. You have to understand, the numbness that with diabetic neuropathy precedes the development of hyperglycemia. Way before the blood sugar becomes elevated, diabetic neuropathy exists. That's a very important thing to remember, okay? Because the nerve is already damaged by a different system, namely the breakdown product of the ketone bodies have their own way of damaging the body that can lead to numbness and tingling and all the rest of it. Way before hyperglycemia comes into play. When hyperglycemia comes into play, as I just mentioned, you have the aldolase reductase activity, which then causes sorbitol to come into the picture, and sorbitol then is devastating to the nervous system and a whole host of other systems. Very serious problem. So it is crucial to know way ahead of time whether someone is diabetic or not. When someone have this, what they're referring to as a let me tell you how ridiculous the so-called pre-diabetic state is. By the time your blood sugar goes up by itself, without us physician doing anything acutely to cause it to become elevated, you've already lost 80% of the beta cell function of your pancreas. And you've been diabetic for at least 10 years with a whole host of other abnormalities. So you got close to 100 million people in this country that have the so-called pre-diabetes, and they're suffering all sorts of abnormalities, all sorts of symptoms. And then you're telling me that pre-diabetes, that is to say the blood sugar is, 120 as opposed 121 as opposed to 124. If it's 124, you're front diabetic. If it is 122, you're pre-diabetic. It's ridiculous. It's absurdity. And years from now, mark my word, as I said before, somebody's going to come in here and try to say exactly what I say was correct. A few days ago, article just came out confirming everything I've been talking about for the last month or so. But years from now, I guarantee you, somebody is going to try to come out, oh my God, Val was right. They're going to do the research proving it is absolutely bogus, the so-called pre-diabetes. It is a disease, serious disease. Read that article, and you will see how serious it is. So now that you completed your physical exam, you do all this other stuff that you got to do, now we're going to get involved in the business of laboratory evaluation, okay? Well, you're going to do a complete blood count, obviously. You're going to do a complete metabolic profile. You're going to add a A1C to it, and I'll tell you a lot about A1C one of these days, because it is not what you think it is. Then, depending on the ethnicity of the individual, you're going to do hemoglobin electrophoresis. That's very important. You're going to do a SED rate. You're going to do an ANA. You're going to do serum ferritin. Because serum ferritin itself, if the iron is very high, that's hemochromatosis, and hemochromatosis is another condition that can damage the pancreas, inevitably, resulting and that's, in fact, there are more conditions that exist in the field of medicine that can cause somebody to develop hyperglycemia, i.e. diabetes mellitus, as opposed to the diabetes mellitus that you inherit from your parents as a gene, about 6 or 7, 8 different genes. But there are more conditions, believe me, several more conditions, way more, that can cause you to become diabetic, hyperglycemic, as opposed to the inherited form of diabetes mellitus. And you have got to know these things. So you do your serum ferritin, you do your SED, you do your ANA, you do the T4 TSH, very important because the person is obese. You do urine analysis. You do all this stuff, okay, and get your hemoglobin electrophoresis done. Very crucial, because crucial to know that. It's got to be quantitative hemoglobin electrophoresis, because if the patient has abnormal hemoglobin, they're going to hemolyze, they're going to spill a lot of iron into the system that's going to ultimately damage the pancreas as well. Listen, I'm going to continue talking about the evaluations that you have to do next week. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.